few months back, I did a series of videos on the topic of foamy urine versus bubbly urine. And I noted at the time, of course, it was in text, it was written in text, it was not verbal. And I noticed there was quite a lot of interest. And at the time, it was about, I think, 6 videos in the series. And so I thought I would do one where I have speaking or talking about it, and it's for you to listen and understand rather than having to read it. And I am compiling all the 6 or 7 videos into one so that you can actually at one go listen, understand, and then complete what you need to require. Now, basically, what is the difference between bubbly urine and foamy urine? You may wonder. And is it really important? How does it affect me, or should I just forget about it? Now, generally, bubbles are bigger, they are clear, and they are flushable. So once you flush the toilet, it is gone, no remains. Foam, on the other hand, is white, and it stays after you flush, kind of lingers on around the toilet bowl. Okay, so that normally gets you worried because after you flush and you see there are foams and white foam still around floating. Now, do note that everyone will have bubbles in the toilet after urinating. So don't jump to conclusions first and panic without further checking or further investigation. Now, when something is very noticeably off, like it smells of urine, for example, or if it is like a super yellow color and not the light yellow, it definitely gets your wheels turning or raises your concern, which is justified. And that's a good thing because your pee can actually tell you a whole lot about your overall health. And it can be very important that you find out if there is a risk to your health at the early stages when you can do something about it or you can salvage the situation. Now, if your pee looks like the color of light tea, for example, it could mean you definitely need to drink a lot more water. And if it's cloudy, it must signal that, or rather it might signal that you've got a bacterial infection going on. But what if it looks foamy as mentioned above? Something's not right. Yep, right, correct, yes. Here's what you need to know if your pee looks like it just came out of a steamer. Some amount of bubbles in the urine is normal, yes, and this can be attributed to how fast the urinary stream is, and for some people it can be like a strong jet of water, and how far the urine has to travel before hitting the toilet or the water in the toilet bowl. So this has an impact on the kind of bubbles that you may see. Now, a normal urinary stream flows at about 15 millimeters per second. Not really very interesting or exciting information, but nevertheless is good to know and good to be aware of. So honestly, if your pee looks a bit bubblier than usual, it might just be coming out a little faster. Like for example, you had a lot of water consumed, but you didn't really have chance to go to the toilet because of work stress or pressures or timing or meetings, right? So if your pee looks a little bubblier than usual, it might just be coming as a little bit faster. Yes, you are younger and able to shoot with greater intensity. Now, our kidneys work to filter out blood and substances in your urine, and particularly is protein. So when your pee looks foamy, it could be due to excess protein, which signals something may be off with your kidneys because you are not supposed to have too much protein in your urine. Just traces, yes, but not too much. Often though, foamy urine is just one of the signs of a damaged kidney. Well, it could be, okay? So other signs include swelling of the body, example the legs, due to fluid retention or weight gain. Now, if you are experiencing any of those symptoms, it's time to see a doctor and have a few tests conducted just to be sure and just to be in the clear, and you will have a peace of mind when you think about it. Now, you are dehydrated. Water and drinking sufficient water is important to us. I think we all know that. Now, water is one of the substances found in urine, so when you're not drinking enough, it can make your urine foamy and a darker shade of yellow. So the more dehydrated someone is, the more concentrated their urine will be as their body tries to conserve water. Well, this is a normal body reaction to protect us from loss of water. This results in foaminess because more substances are excreted in a smaller volume of water. Now, if you spot foamy urine, a good first step is increasing your hydration to see if that helps. You know the old adage about drinking 8 glasses of water a day? Yes. And do space out the water consumption or you will be going to the toilet very often, especially in the wee hours of the morning. This can be disruptive to a good night's sleep and disturb others around you. You have diabetes or hypertension. Now, protein in the urine is at play here once again. Both conditions, diabetes, which affects the body's insulin levels, and hypertension, also known as high blood pressure, can affect the blood level flow to the kidneys, impairing their function or making them less efficient. This increased pressure causes increased stress, which leads to damage and protein in the urine, which again can result in foaminess, right? So again, both diabetes and hypertension have other symptoms too. Diabetes often comes with increased urination and thirst. Hypertension can manifest as chest pain or shortness of breath. So if you are experiencing these symptoms along with the foamy urine, let your doctor know. Do check it out just to be sure that it's nothing, and if it is that, you can take action soonest. Now, you may have a chronic infection. Chronic infections like hepatitis can also cause excess protein in your urine. Some infections can directly attack the kidney filters, others causing inflammation that can affect your kidneys' function. So you see how important it is that you have your healthy kidneys. Now, if you've been battling a chronic illness and your urine looks soapy or sudsy, check with your doctor. A simple urine test can check for the presence of too much protein in the urine, and your doc can figure out what to do from there. Now, what if you're in the habit of taking pain meds? If you've been taking over-the-counter painkillers for a while and your urine is looking foamier than usual, those pills could be to blame. Example, Advil, Motrin, and Aleve can cause you to have high levels of protein in your urine. Now, even worse, sometimes those pain meds can result in an allergic reaction that causes inflammation in your kidneys. It's not a great idea to take any over-the-counter painkillers for an extended period of time without medical supervision. So you have been on a steady regimen of Motrin to combat some kind of ache. It's probably smart to check in with your doctor to make a long-term plan for pain management. Or you could have an autoimmune disease. Now, autoimmune conditions also put stress and strain on the kidneys, potentially causing enough damage to disrupt the filtering process. So you see how important the kidneys are to you and how much pressure and stress it can be affected by. Now, similar to chronic viral infections, autoimmune conditions can lead to protein in the urine via the patient's own immune system mistakenly attacking the patient's own kidney filters. Who notes that these conditions can be exclusive to the kidneys or systemic like lupus. Now, what are the symptoms of autoimmune conditions? It can vary, but there are several things in common. For example, fatigue, joint pain, recurring fever, for example. So if you see foamy urine and you haven't felt like yourself for a while, it's worth checking with your doc. A simple blood sugar test and urine test can help to clear up any doubts, and if there's something not right, this can be fixed at the early stages where medication can help. It is a good idea to have a yearly medical examination even when you are very young, or sometimes to go for a simple blood sugar test from time to time, which just requires a prick of the finger, and it can be done in any pharmacy. And you can find out whether there may be too much sugar in your blood, in your urine, for example, and maybe if you think that you are worried, then you can check out with the doctor to make yourself less worrisome about it. Okay? Have a good day.